Hey guys, welcome back to this Price. This is the second part of pregnancy video, and you are gonna see the type of pregnancy. After seeing the pregnancy first part video, we are gonna continue the second part. Pregnancy can occur in the different forms based on various medical and biological condition. Here are the main types. First comes normal pregnancy, that is intrauterine. This is the most common type where a fertilized egg implants inside the uterus and develops into a fetus. It lasts about 40 weeks and is divided into three trimesters. Subtypes of normal pregnancy are singleton pregnancy, one baby is developing; multiple pregnancy, that is twins, triplets, etc. More than one baby develops due to multiple egg fertilization. And next is all about multiple pregnancy, that is twins or triplets, etc. More than one baby develops due to multiple egg fertilization or embryo splitting. And next it's all about high risk pregnancy, a pregnancy that increase risk for the mother or baby due to health condition or complication. It requires extra medical care. Causes of high risk pregnancy: maternity, health issue, diabetes, high blood pressure, heart disease. Age factor: pregnancy before 18 or after 35. And multiple pregnancy carrying twins, triplets, etc. History of miscarriage and premature birth. So these are the causes. And next it's all about ectopic pregnancy. In this case, the fertilized egg implants outside the uterus in the fallopian tube. This is a medical emergency, as in cause internal bleeding and requires immediate treatment. Symptoms are sharp abdominal pain, bleeding, dizziness or fainting. So treatment, surgery or medication to remove the pregnancy. And next it's all about chemical pregnancy. Very early pregnancy loss that occurs before the fifth week, often before the woman even realizes she is pregnant. It happens when the fertilized egg fails to implant properly in the uterus. What are the causes? Chromosomal abnormalities, hormonal uterine issues. And next it's all about blighted ovum. A fertilized egg implants in the uterus but no embryo develops. It leads to early miscarriage. Symptoms: pregnancy symptoms at first, eventually symptoms fades and miscarriage occurs. And next it's all about triptic pregnancy, that is a rare situation where a woman doesn't realize she is pregnant until labor. Causes: hormonal imbalance, irregular periods, psychological factors. And next it's all about tubal pregnancy, a specific type of ectopic pregnancy where the fertilized egg implants in the fallopian tube instead of the uterus. And the dangers are: can rupture the fallopian tube, cause life-threatening bleeding, requires emergency treatment. And next it's all about surrogate pregnancy. In this case, a woman surrogate mother carries a pregnancy for another person for couple. This is done using IVF, in vitro fertilization, where the intended parent's embryo is implanted into the surrogate uterus. And next is all about IVF pregnancy, in vitro fertilization pregnancy, a pregnancy achieved through assisted reproductive technology where fertilization happens in a lab and the embryo is implanted into the woman's uterus. So used when natural conception is difficult, fertility issues exist, same-sex couple, single parent want a child. And next it's all about abdominal pregnancy, a rare form of ectopic pregnancy where the fertilized egg implants in the abdominal cavity instead of the uterus. It can be dangerous and require surgery. So it's all about twin and multiple pregnancy, that is identical twins. One fertilized egg splits into two embryos. The babies share the same DNA and look alike. And that is, two different eggs are fertilized by two sperms. The babies do not look identical and can be different gender. Last, iota multiple, that is, can result from natural conception or fertility treatment, requires specialized medical care, that is triplets or quadruplets, etc. These are the most complicated cases in pregnant. IVF is very common in all these couples. In vitro fertilization is a medical procedure that helps people conceive a baby when natural pregnancy is difficult or impossible. So let's see the step-by-step procedure. First come ovulation stimulation, that is hormone treatment. The woman takes fertility medication to stimulate the ovaries to produce multiple eggs instead of just one. Regular ultrasounds and blood tests monitors egg development. Next, it's all about egg retrieval. That is, once the egg matures, doctor perform a minor surgical procedure called follicular aspiration to collect them from the ovaries. This is done using a thin needle guided by ultrasound. Next, it's all about sperm collection and preparation. The male partner provides a sperm sample or donor sperm is used, and the healthiest sperm are selected in the lab. And next is all about fertilization. The eggs and sperms are combined in the petri dish for fertilization. In cases, intracytoplasmic sperm injection is used, where a single sperm is injected directly into an egg. So it's all about embryo development and selection. Same-sex couples or single parent using donor eggs or sperm. So what are the types of IVF? Traditional IVF, natural fertilization of egg and sperm in lab. And next it's all about ICSI, that is intracytoplasmic sperm injection. A single sperm is injected directly into the egg. All about frozen embryo transfer, that is previous frozen embryos are thawed and implanted. And next it's all about donor egg or sperm IVF, used when couple cannot use their own eggs or sperm. And next it's all about surrogacy IVF. A surrogate mother carries the pregnancy. So success rate of IVF in India is like success depend on age, health and condition and client. Women under 35 have a 50 to 60 success rate per cycle. Women over 40 have a lower success rate, that is 10 to 20 percentage per cycle. The risk and side effects of IVF, that is multiple pregnancy, twins, triplets would be happening, ovarian hyperstimulation syndrome would be happening, ectopic pregnancy would be happening, that is embryo implants outside the uterus, emotional stress, anxiety due to repeated cycle if IVF fails. So average cost of IVF in India is like 1,20,000 to 3 lakh per cycle. Egg retrieval, fertilization and embryo transfer. Broad range, some sources indicates cost between 2,15,000 to 4 lakh per cycle depending on various factors and hospital. So what are the factors influencing IVF cost? It's all about medications, it's all about clinical location, and it's all about additional procedures, and it's all about number of cycles. All these things must be measured, and that way this particular cost would be prepared. Probably you must have insurance coverage. Most health insurance policy in India do not cover IVF treatment cost. However, some providers may offer fertility treatment coverage as an add-on or rider. The essential to review policy details carefully so that you would be mentally prepared. So tips to manage IVF costs: compare clinics, evaluate prices and service offered by different IVF centers. Financial planning is really required. Only then you can get a child. Be really prepared. And next, the most important, mental awareness for pregnancy. Same way partners mindset should be positive, and same way relationship and family support must be there, and same way mental preparedness for delivery and motherhood must be felt inside this particular part. And the most important, partners must discuss about the pregnancy cost and how it is all about how you are gonna do all these things, etc. All this budget and financial planning must be made early as possible, and all this health insurance and maternity benefits must be aware about. And most important, financial planning for baby's future. Expenses such as diapers, baby food, clothes, cribs, stroller and vaccination. Unexpected costs may arise due to medical or child care needs. And same way, education saving plans such as start planning for your child future education early. Only if you do all these things, or else you would be so you know about the test which you're conducting. So first comes pre-pregnancy test before conception, that is blood test, checks for anemia, thyroid functions and infection. Robles immunity test ensures protections against germ disease, and diabetes test check for high blood sugar level. STI test screens for HIV, hepatitis B, syphilis and other infections. Genetic carrier screening detects inherited conditions such as thalassemia, sickle and anemia. And next, the most important, first trimester test, that is weeks 1 to 12. These urine test confirms pregnancy by detecting HCG hormone. Next is in order to find blood type, and RH verifies compatibility with the baby's blood type. And same way, complete blood count such as checks for anemia or infection. And same way, ultrasound, that is 6 to 8 weeks, confirms fetal heartbeat and estimated due date. And same way, neutral translucency, that is NT scan, 10 to 13 weeks, screens for Down syndromes. And same way, non-invasive prenatal test, that is detects chromosomal disorder. Next, it's all about second trimester test, that is weeks 13 to 28. Quad marker screen, that is 15 to 20 weeks, identify risk for birth defects. Same way, anatomy ultrasound, that is 18 to 22 weeks, examines the baby's organs, spine and limbs. And next, it's all about gestational diabetes test, that is 24 to 28 weeks, checks blood sugar level. And next, it's all about aminoacidosis, that is if needed 50 to 20 weeks, diagnoses genetic disorders. Last, third trimester test, that is week 29 to 40. First comes group B strep, that is test 35 to 37 weeks, checks for bacterial infection that could harm the baby. And next, it's all about non-stress test. It's all about after 32 weeks of needed rest, monitors fetal heart rate and movement. And next, biophysical profile, that is BS, that is after 32 weeks, assess baby's breathing movement and fluid levels. And Doppler ultrasound test, that is measures blood flow to the placenta. So next, it's all about the cost of pregnancy. All these things you must be aware, so that I'm just discussing it out. So I hope this video is interesting, and I have made the second part of the video, and I feel the second part of video is not enough. So I'm gonna say the remaining part of the video and the final part of the video and the last part. And with that thought of this video, take care.